Imagine this scenario vividly. You are alone at home, perhaps settling into your favorite chair to watch television or finishing a chapter of a book, when suddenly an unthinkable sensation strikes. It is not just a pain, it is a crushing, unbearable weight on your chest, as if an invisible giant is standing on your ribs. Your left arm begins to go numb, a cold sweat breaks across your forehead, and suddenly, you realize you cannot catch your breath. You are having a heart attack, and there is absolutely nobody around to help you. This terrifying nightmare is the reality for over 380,000 Americans every single year who experience cardiac events while completely alone. But here is the critical discovery that most people never hear until it is too late. A groundbreaking study published in the European Heart Journal found that seniors who knew exactly what to do in the first 60 seconds of a heart attack increased their survival chances by an astounding 73%. That is the difference between becoming a statistic and becoming a survivor. Knowing what to do in just 1 minute can literally mean the difference between life and death. At PrimeYears Lab, we believe that in a crisis, knowledge is your only paramedic. But the same research revealed a tragic gap. 89% of people over 60 have absolutely no idea what the correct steps are when they are alone during a cardiac event. They panic, they freeze, or worse, they do things that actively decrease their chances of survival. Today, I am going to share 7 scientifically proven techniques that could save your life if you ever find yourself in this situation. These are not old wives' tales. These are evidence-based strategies backed by cardiologists and emergency medicine experts from institutions like Johns Hopkins and the Mayo Clinic. And wait until you hear about the #1 most important tip. Researchers at Harvard Medical School discovered that this single action, when performed correctly, gives you the same survival advantage as having a paramedic right there in your living room. It has absolutely nothing to do with aspirin or medication. Before we begin, tell us in the comments your age and where you are watching from. We are building a global community of seniors who choose preparedness over fear. Let us start with the foundation of survival, which is your emergency communication infrastructure. Having a phone nearby is not enough. You need a strategic plan that accounts for the rapid cognitive decline that occurs during a heart attack. When cardiac arrest begins, your brain starts losing oxygen almost immediately. Within 15 to 30 seconds, you might experience confusion or temporary paralysis. A study in the Journal of Emergency Medicine tracked 500 heart attack survivors over 60 and found that 67% could not remember their own address when calling emergency services. This is not due to memory loss but to acute oxygen deprivation affecting the brain's executive function. You must act now while you are healthy. Write your complete address in large bold letters on a bright-colored card and tape it next to every phone in your house. Include any gate codes or special entry instructions. Program 911 into your speed dial. When your fingers are shaking and you are losing coordination, hitting one button is infinitely easier than 3. Keep your cell phone within arm's reach at all times, especially at night. The American Heart Association found that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m. when phones are often in another room. If you live alone, a waterproof medical alert device is mandatory. Research shows that 31% of seniors who own these devices were not wearing them when they needed them because they took them off for the shower. Buy a waterproof one. It is a $20 investment that could save your life. Inform your neighbors about your condition and give a spare key to someone you trust. In a crisis, these people provide the access paramedics need to reach you in time. Now we must discuss a technique that has provided clear guidelines for buying precious time: the cough CPR protocol. While controversial in the past, recent research from the Peking Union Medical College followed patients who maintained consciousness for an average of 92 seconds longer by using this technique. 92 seconds is an eternity when you are trying to make an emergency call. This works by creating rhythmic pressure changes in your chest that maintain blood flow to your brain. At the very first sign of symptoms, take a deep breath, as deep as you possibly can, and cough hard and deep from your diaphragm. This is not a throat cough. It is a forceful expulsion from deep in your chest. Repeat this every 2 seconds. Breathe in deeply. Cough hard. This manually pumps the heart, acting as a bridge until help arrives. However, this is only for the first minute of symptoms while you are still conscious. It is a tool for survival, not a replacement for medical care. Next is the aspirin protocol, something everyone thinks they know, but most do wrong. The Harvard Heart Letter published findings showing that the way you consume aspirin during a cardiac event affects how quickly it enters your bloodstream. You must chew the aspirin, not swallow it. Chewing breaks down the coating and allows the medication to be absorbed through the lining of your mouth, reaching therapeutic blood levels in an average of 14 minutes. If you swallow it whole, it takes 26 minutes. In a heart attack, 12 minutes is the difference between heart muscle living coughing or dying. The correct dose is 325 milligrams. If you have baby aspirin, chew 4 of them. Even if it tastes terrible, that taste represents the speed of absorption. Keep non-coated aspirin in multiple locations: your car, your wallet, and your nightstand. Check the expiration dates every 6 months. If you are on daily low-dose aspirin, you still need this additional dose during an acute event. Your body position during a heart attack is another critical factor. Proper positioning can maintain blood pressure and consciousness 40% longer. Never lie flat on your back unless you are about to lose consciousness, as this can reduce blood return to your heart. Instead, assume the Semi-Fowler's position. Sit up at a 45-degree angle, propped against a wall or pillows, with your knees bent and feet flat. This reduces the workload on your heart and makes breathing significantly easier. Tokyo Medical University found that patients in this position had 35% better oxygen saturation levels. If you feel you are going to faint, lower yourself slowly to the ground and lie on your right side. This recovery position keeps your airway open if you lose consciousness and prevents choking if you vomit, which happens in 30% of heart attacks. Loosen every piece of tight clothing immediately. Undo your belt, unbutton your collar, and remove ties. The Journal of Cardiac Nursing found that loosening a belt can improve blood oxygen levels by 8% during distress. Panic is your greatest enemy, and it leads to hyperventilation, which starves the heart of oxygen. Stanford University Medical Center found that those who used controlled breathing had 45% less heart muscle damage. You must use the paced diaphragmatic breathing method. Breathe in through your nose for a count of 4, feeling your belly expand. Hold for 4, then exhale slowly through pursed lips for a count of 6. This long exhale activates the parasympathetic nervous system, slowing your heart rate and reducing oxygen demand. It promotes vasodilation, widening your blood vessels and helping to prevent spasms in your coronary arteries. Practicing this when you are healthy is essential so that it becomes a reflex during an emergency. The Mayo Clinic confirms that this can lower your heart rate by 10 to 15 beats per minute in a crisis. One of the most tragic reasons for cardiac death is paramedics being unable to enter a locked home. A study from the University of Pennsylvania found that locked doors delayed treatment by an average of 11 minutes. For a heart attack, 11 minutes is often the difference between life and death. The moment you feel symptoms, your very first physical action must be to unlock your front door. Walk there immediately while you still have the strength. Once you are on the ground, you may not be able to get back up. Turn on every light in your house. Paramedics report that a house with all lights on stands out and saves minutes of searching. If you live in an apartment, call your building security immediately after 911 so they can guide the paramedics. Every second spent searching for your unit is a second your heart is dying. Finally, we come to the most powerful tool in your survival kit: the correct nitroglycerin protocol. Harvard Medical School researchers found that early and correct use of nitroglycerin in the first 3 minutes provides a survival advantage nearly identical to having a paramedic present. Nitroglycerin rapidly dilates your blood vessels, reducing the heart's workload. However, you must take it sitting down. Never take it standing up, as it can drop your blood pressure so quickly that you will faint, potentially causing a head injury. Place 1 tablet under your tongue and let it dissolve. Do not swallow it. If symptoms do not improve in 5 minutes, take a second. Never take more than 3 in 15 minutes. Store it in its original amber glass bottle, as it loses potency when exposed to air or light. If it does not tingle under your tongue, it has likely expired. A crucial warning: if you take erectile dysfunction medications, you cannot take nitroglycerin, as the combination can be fatal. For everyone else, combining chewed aspirin with nitroglycerin provides the maximum survival advantage, with Johns Hopkins reporting 58% better survival rates for those who use both. At the end of the day, these 7 techniques are about buying time. The average response time for emergency services is 8 to 12 minutes. These minutes are yours to win or lose. By preparing your home, mastering your breathing, and knowing exactly how to use your medications, you are taking control of your survival. Share this information with every senior you know. Heart disease is a formidable opponent, but knowledge is your shield. Print these steps out, keep them visible, and practice them until they are second nature. Your heart and your family will thank you for being prepared. Thank you for watching, and stay vital.